What if you could not only improve patient outcomes, but also significantly increase reimbursement by integrating EMG nerve conduction studies and musculoskeletal ultrasound in your practice? Why are more and more physical therapists are turning to diagnostic testing? And how is this reshaping both clinical care and insurance reimbursement? And is your practice leaving revenue on the table by not utilizing the diagnostic tools that justify medical necessity and elevate your documentation? This and many more topics in today's podcast, Your Practice, Your Money, where clinical success meets financial freedom. Hello, everyone, and thank you so much for joining me today. Today's first episode of a series of presentations that we're going to have. They are around the area of how to transform physical therapy with diagnostics. And this is going to be a 13-week educational series experience. And if you like to know the topics that we will be handling in the next 13 weeks, you can go to this website, discoverdiagnostics.com, and you will be able to view all the different topics that we will be covering every week. And it's going to be a very engaging, very interesting program. I have with me every week different guests that are appropriate to discuss a variety of aspects of diagnostic testing in a clinical practice. They will be covering financial aspects. We're going to be covering staffing aspects, clinical aspects, costs, as well as troubleshooting for cases where challenges might arise. But today, we are going to start with an introduction to diagnostic testing for physical therapists and discuss specifically why it matters. I have with me today Dan Sage, who has actually gone through different phases of implementation of the diagnostic testing facility in a very successful fashion. And he will share some of it with us today, although we're going to hear from him again in some of the subsequent presentations in this series. So thank you very much once again for joining me. I will start first by saying that when we are talking about diagnostics, and I want you to look at this in terms of this industry. Diagnostic testing is a $250 billion industry. And, it is very untapped or very little tapped as an industry by the physical therapy profession, to the extent that the physical therapy profession has approached diagnostic testing has been perhaps in the area of functional capacity evaluations or back to work programs and so on and so forth. But when it comes to actual diagnostic testing of medical grade, very few physical therapists have formed or being knowledge about. And I will explain in a moment why is that. But this is shared with you a huge industry. It's a $750 billion industry. And physical therapists do have a major place in this industry. They can tap these dollars, but it is not only financial. They can provide significant benefit to their patients and expand significantly the physical therapy profession. So I want to discuss for a moment the clinical challenge and the solution for that clinical challenge. What if I told you a few years ago we were all plagued by COVID, right? And what if I told you that you put in a room 100 people who were sick with COVID? They were infected with COVID. All right. I don't want to make it worse and say like Ebola or something like that. I'm saying just COVID. Okay. So let's say 100 people, they have COVID. And what the tests that the medical profession has identified, how many of these people have COVID, identified positive only 21% of them. So out of 100, that test identified only 21. Or 30% of them. Would that be a great test? Well, that's very questionable, isn't it? So, but this is what we face when in physical therapy and in other fields of medicine, we are utilizing only our physical examination tests. And I'm sharing here with you that, for example, in a case of a carpal tunnel, the Tinel sign, which is the median Tinel's, a very common test, has only a 23% sensitivity. And the Phalen's test for median nerve has only a 51% sensitivity, leaving on the table potentially more than half of the patients who do have the condition, who do suffer from the condition. If you take other cases, let's say cervical radiculopathy, we are using a lot Sperling's test. Sensitivity of Sperling's test is only 30%. So how about if we were able, with other testing, to have much higher sensitivities and specificities for that matter? And that's why, besides the physical examination area, you look at other areas that can provide higher degrees of both sensitivity and specificity. The areas of diagnostics can include electromyography, musculoskeletal ultrasound, and yes, MRIs. However, a physical therapist cannot use an MRI. Yes, maybe in some cases can order an MRI, and the PT profession is striving towards that direction. We're trying to get the PTs to be able to order MRI the same way they can order X-rays and MRIs in the military, the same way to be able to provide these out in society. But even if we get to a point where a physical therapist will be able to prescribe an MRI, the physical therapist will not be able to perform an MRI. So, however, right now, a physical therapist is able to perform both an EMG and a musculoskeletal ultrasound, interpret these tests, bill insurance companies for these tests, and get paid for these tests. So then we are introducing here a very unique principle, the principle of POC, point of care. These are point of care diagnostics. These are diagnostic tests that the physical therapist can perform right on the spot, because during the initial evaluation, you identified some type of pathology that does require further evaluation, further investigation. And as part of point of care, you can perform these tests and help your patients in their conditions. So again, here, I'm giving you a little bit more of this perspective in terms of the carpal tunnel. You see here that thinner atrophy has a 66% sensitivity in carpal tunnel. Tinel's, I said 23%. And Fellenstein has 51% sensitivity and 76% specificity. Now, let's look at EMG testing. EMG testing in carpal tunnel has a sensitivity of 86% and a specificity of 98%. Musculoskeletal ultrasound. So in this case, we're talking about neuro ultrasound, nerve ultrasound, imaging nerves, right? It has about a 77, 78% sensitivity and an 86.8% specificity. Right. So, I mean, you see the sensitivity of MRIs, 85.5%. Why would you send a patient for an MRI that takes close to 45 minutes to an hour, being enclosed in a place? You do not perform your test yourself, while you can have as point of care in a physical therapy primary care setting the performance of EMG testing for patients with carpal tunnel. But how about other conditions? Let's see here, cubital tunnel. That is entrapment of the ulnar nerve at the elbow. So you have Tinel sign at the elbow. It has a pretty good sensitivity, 70%, but it does not compare with the sensitivity of EMG, 88% sensitivity and specificity. And the elbow flexion test has a very low sensitivity, as you can see, 32%. And musculoskeletal ultrasound, 80% sensitivity, 91% specificity. Looking at cervical radiculopathy, well, this is really a no-brainer. You can see clearly that EMG has a 71% sensitivity, and actually conventional MRI has only 56.7% sensitivity for cervical radiculopathy. And interestingly enough, when we look at rotator cuff, right, injuries, away from nerves and the spine, let's look at tendons, right? If you look at Near's test has a sensitivity of 79%, specificity is 53%. Hawkins-Kennedy, pretty similar sensitivities and specificities, 79% and 59%. Now, MRI does have a sensitivity of 92.1% in a rotator cuff tear. But let's look at the sensitivity of musculoskeletal ultrasound in a case of point of care ultrasound. It's called POCUS, point of care ultrasound. Comparable both sensitivity and specificity to an MRI showed the 2009 study of the Jesus and Parker et al. And many more studies are verifying these findings. All right, so when we are looking about a musculoskeletal ultrasound in physical therapy, how can we use it? What do we use it for? We can use it both in a diagnostic capacity as well as in a treatment capacity. Looking at diagnostic capacity, we have, of course, joint ultrasound, where you can image essentially every single joint in the body. Or I should not say every single joint. I should say most larger joints in the body. So your shoulder, elbow, wrist, hand, joints, hip, knee, the ankle and the foot, the sacroiliac joint. You can visualize facets. It is not the best testing to look at actual disc pathology, but visualization of facets and the SI is there. Also, neuromuscular ultrasound, neuromusculoskeletal ultrasound. Here you can visualize the actual peripheral nerves, your median nerve, your ulnar nerve, and you can correlate this data together with the electrodiagnostic data to make more sense and definitive conclusions about your patient's pathology. And of course, you can visualize pelvic floor for other type of conditions. Now, can you use musculoskeletal ultrasound in terms of treatment? And the answer is yes, you can. You can utilize it to identify muscle recruitment. You have a muscle firing, you can visualize under MSK ultrasound the recruitment of the muscle itself for feedback purposes. Now, many of you may be doing neuromobilization. In a subsequent, more clinical type of presentation, I will be showing you actually when you mobilize, let's say, the median nerve at the wrist, or moving the elbow, or moving the shoulder, or even moving the neck, how you can have movement or how you can visualize in neuroultrasound movement of the median nerve, the ulnar nerve, at the area of the wrist, okay? Just by moving the neck, you can see movement of the nerve in both a long axis as well as short axis. And you can see when a nerve is stuck and it doesn't move enough, and when you apply the neuromobilization techniques, how that can improve the mobility. But also, in certain cases where we do EMG testing, we can use the MSK ultrasound to guide the EMG needle. Now, many physical therapists in many parts of the country, you are doing dry needling. Well, MSK ultrasound can help you identify a more precise location for your needle insertion. So, for example, you can visualize under MSK ultrasound areas of the muscle that are more fibrotic. You can visualize areas that are more nodular. You can visualize areas that they are more inflamed or they have more fluid in that vicinity. And you can direct your needle in those areas. And not only that, but also there is a special CPT code that you can use to actually bill for the guidance of the needle, of your dry needle. You can evaluate treatment progression. And in the event you are working in a hospital or you are working in conjunction with a physician where they are doing either injections or aspirations, you can help them to guide the needle for the physician, working together as a team. So there are many, many uses. Now, let's look specifically at some of the benefits and risks. First of all, let's indicate here that both the imaging section of the orthopedic section, of the imaging special interest group of the orthopedic section of the APTA, but also the neuro MSK special interest group of the Academy of Clinical Electrophysiology and Wound Management fully support PTs providing MSK ultrasound. APTA works closely with AIUM. AIUM is the American Institute of Ultrasound in Medicine, and this is the organization that insurance companies utilize to decide which professionals they should reimburse for MSK ultrasound. So AIUM has provided full recognition for physical therapists performing MSK ultrasound when properly trained, of course. As a matter of fact, physical therapists can take the RMSK exam and become board certified in the same capacity as physicians in the area of MSK ultrasound. Now, of course, you have to meet specific requirements in order for you to take this exam, and you have to make sure that you receive your training from reputable organizations, okay? Not all training is the same. So you have to make sure that you receive training that is not just classroom training. Think about this. When you went to the physical therapy school, right? At some point, you learned manual therapy techniques. You learned mobilization. Just imagine if you took a class on mobilization when you were a student. I'm not talking about later on if you took additional continuing education, but you were a student at the university. You took some courses there on mobilization, manipulation. Just imagine that right after that, without any clinical practicum under the auspices of a licensed professional, without any actual practical training, you started treating patients. Well, that would not be that successful. That would be actually dangerous. Same thing here. Be aware of programs that do not provide mentorships. You always want to have a program that combines both classroom education, but also mentorships. For example, the program of the American Academy of Musculoskeletal Ultrasound provides actual fellowship with mentorships, with a board certified mentor mentoring 150 reports of yours, which qualifies you then to go and take the RMSK examination report. Okay? That's why they have it as a requirement. Now, MSK ultrasound pays physical therapists for testing. Most insurances will reimburse $100 to $200, sometimes more, for 1 or 2 units of MSK ultrasound. Now, in Medicare, except of Noridian Medicare, the rest of the Medicare intermediaries have not included yet physical therapy in the, they have not included yet the MSK ultrasound codes in the physical therapy taxonomy, but this is actually something that actively APTA is working right now, and I am working with this APTA team to help them bring that into fruition. Keep in mind, though, as I said, that the vast majority of all other insurances do reimburse physical therapists for MSK ultrasound. All right, now let's talk a little bit about EMGs. Well, physical therapists perform EMG studies for more than 45 years now. We have the ECS, Electrophysiology Clinical Specialty Certification Program of ABPTS, and the Academy of Clinical Electrophysiology and Wound Management, ACWM, was formed, and there is actually an EMG special interest group. There is an actual laboratory accreditation that is offered by the association. Of course, I am endorsing the program of the American Academy of Clinical Electrodiagnosis and the hands-on diagnostics residency program that helps you to achieve all requirements you need for board certification. Again, EMG nerve conduction studies can be diagnostic for localization, severity, and prognosis of a condition, and it helps you create a better treatment plan. Okay, better treatment plan, and in future discussions, I'll present to you even some studies. But let's look at risks and benefits, okay? Today's discussion is a bit more general, so I want you to get a basic idea about this, risks, benefits, some financial aspects, and in the subsequent meetings, I'm going to delve into very specific topics so you guys can walk away with total certainty about if this is something you want to pursue, or if you are pursuing it, how you can improve it. All right, so APTA, of course, is fully supporting PTs performing EMGs, and most state practice acts, except of New Jersey, Nebraska, and Hawaii, allow physical therapists to perform electrodiagnostic studies. Not only that, but CMS provides full recognition to board-certified physical therapists to perform electrodiagnostic studies. So you are recognized by the federal government. This is the ECS exam that we have. And in terms of reimbursement, you get paid an average of $500. That's nationwide reimbursement, a variety of insurances, okay? And as I said, Medicare also pays for electrodiagnostic testing to board-certified physical therapists. There are tremendous benefits of diagnostic testing. Diagnostic testing will increase accuracy of the evaluation of your patient. You performing diagnostic testing in your practices, you provide patients with faster access, okay? Those of you who know me, you know that I'm practicing in New York and Florida, but I'll speak more about New York. In New York, we have a very, very large organization working with several major hospital organizations where they are sending to us their overflow of patients for EMGs and MSK ultrasounds because simply they cannot handle the volume and their patients have to wait for 6 weeks, sometimes 8 weeks to receive a single test. Meanwhile, we can provide access within 24 hours from the moment of the request and a report within 48 hours, okay? So this is why my organization here in New York performs more than 1,000 tests a month. So better patient outcomes and patients who are happier and healthier, and they participate more on their care. Now, you may consider this, that it's just an arbitrary point here. It is not. This actually has been studied. This item here actually has been demonstrated by studies that patients participate by more than 90% in their care compared to patients who have not received data from EMG testing. All right. For a physical therapy practice, it creates greater clinical autonomy. It helps you differentiate your practice from the competition. You bill for these diagnostic tests, not under PT, but under special diagnostic tests payable to PTs. You'll increase by 30% your total revenue of your practice just by implementing diagnostics. All right, and risks, yes, the EMG needle can be slightly uncomfortable, but technique, okay? The better your technique, the less impact to the patient. And if there is no insurance reimbursement, let's say at all by a specific arbitrary insurance, then the patient you will charge them out of pocket. And in terms of your practice, as I said, MSK ultrasound right now is paid only by Meridian Medicare and not by the rest of the Medicare. So many of our people charge cash for that. Right. So if you are a private practice owner, how your staff members can implement this new paradigm for physical therapy? Well, you have the regular model or PT evaluation, treatment plan, intervention, reeval, continuation of PT, and ending of care. And then you are adding diagnostic testing in the proper subset of patients so that you utilize also not only your physical examination data, but you're using diagnostic testing data to derive to a more appropriate treatment plan. So you utilize both to create a better treatment plan for your patients. All right. And this is a study. Briefly, I'm going to show it to you, but I want to talk more about it when we talk about clinical. We identified in this study more than 465 patients participated, a multi-center study across the country. The patient management was 61% of the patients as a result of the EMG in MSK ultrasound testing results. All right. Why more PTs are not doing this? Well, in 2013, we ran a nationwide study through on-target research, and they identified that only 3% of PTs, they knew about these services, and only 2% they knew that they can even bill about these services. So Hands-on Diagnostics started a major campaign with publications, with books, with research articles, with presentations at APTA and other organizations to disseminate the message that PTs can perform these tests. So 10 years later, from 2013 to 2023 now, we ran this study again, and we identified from the survey that 75% of PTs were now aware of these tests, and 62% understood the billing process. And this is why the last couple of years, there has been tremendous growth in the area, and more PTs, they are knocking our door to get trained and implement this in their practices. So a couple of words about the financial aspect. Obviously, you know that there are major challenges for private practice PTs. I'm going to be talking about that time and time again in this series of presentations. But listen, salaries are getting higher and higher. The cost of living is getting higher. Your expenses are getting higher, and your reimbursement is getting lower. So where does this come from? This difference, it's from your actual profit. And that's why PT profit margins, they are between 8 to 12%. Medicare decides to decrease reimbursements by 3, 4, 5%. Medicare sneezes, and all of a sudden your practice is being threatened. Well, look at this. Diagnostics pay 3 to 10 times more than PT. A national average for a PT visit is $95 for a PT visit. National average for a combination of EMG and neuro ultrasound is $700. Right? So this is 7 times multiple, essentially. A variety of practices, time and time again, within a period of 12 months, they have realized significant growth, significant increase in their reimbursement rates just because of the implementation of diagnostic testing in their practices. I'm going to share now the stage with Dan, who is going to just talk to us a bit about his experience and how, what he did, how he got involved in diagnostics and why, and all that.
I appreciate everybody on this call. You're on the right journey. I mean, this is a great 13-week webinar series to really dial into how you can transcend what you're doing in patient care, how you can make a difference, and how you can really look to improve your professional growth, your financial growth. And I'm just excited that you're here. And to give you a little background about me, I've been a PT for about 30 years, was in private practice 27 years. Back in 2013, I found out about diagnostics, right? Like Dimi was saying, in 13, they started really pushing it. And I am in South Florida in a big, big Medicare market. And I was like, wow, PTs can do diagnostics? I mean, so I checked with Medicare. Absolutely, we can. And it's pretty awesome that we are identified as providers that can perform these services that neurologists and physiatrists do, right? So that checked the box. But for you guys that are on this call and your PTs, maybe your PTs or your owners or whatever the case is, the biggest thing that really pushed me to say this is a no-brainer was, number one, I believed in my PTs. I wanted my PTs to have greater decision-making, autonomy. I wanted to raise their evidence-based practice. I wanted to improve their ability to make a diagnosis. Like we looked at earlier, the reality of our sensitivities, of our special tests, they're not the greatest. And that is a direct threat to our survival as PTs. You look historically, the last 5+ years, the evaluation code is getting reimbursed less and less. That's the one code sacred to the PT, is our evaluation code. It kind of defines us in terms of our critical thinking abilities, the ability to make a difference with patients. PTAs share the other CPT codes, but it's getting valued less and less, and it's not okay. And I can tell you that I am a big believer in everybody on this call. I believe that PTs should be the primary care providers of musculoskeletal pain pathology. I believe that we should have true autonomy in decision making. And you know what? We are in 2025, and we're getting hammered as a profession, and it's not okay. And I applaud you guys for being on this call, because you are discovering something. You're looking into something. You're wondering, well, what is this diagnostics? What can it do for me? And I can tell you, this is what it did for me and my practice in my patient care. So we pulled the trigger in 2013. We implemented diagnostics. Over the years, I've gotten several therapists trained, but I never, ever, ever realized what it would do in terms of elevating our care of patients. And we've had patients come in with plantar fasciitis from the podiatrist, not getting any better. Well, we have an EMG program. We'll do a lumbar EMG, and guess what? It's coming from the back. Even though the patient came to me from a podiatrist with a prescription of plantar fasciitis, we were able to pivot the care and change the outcomes for this patient. What PT wouldn't want that? What patient wouldn't want that? What doctor wouldn't want that? From a professionalism standpoint, I believe that Hands-On Diagnostics, when it was created, and the vision that Dimi and his team had, is a blessing to our profession and an opportunity for us as PTs to get to that APTA Vision 2020 of autonomy, decision-making, financial value. It's okay for us PTs to make money. Doctors do, accountants do, physicians do. Why are we getting paid less and less? It's not okay. And unfortunately, it's not getting any better. So for me, it was a game changer for patient care. I transcended the careers of my PTs. There's an APTA article, and I can share this with anybody. You can ask questions. If anyone has any questions, you can put it in the chat now. You can reach out to my links here. I am a resource to you, because what you're doing is the absolute right thing. Because as PTs, the APTA put out an article in 23 that the average PT doing EMGs gets paid $70,000 more a year than any other PT in our profession. It's the value of what we're providing. It's okay to make money. We're making money backed by purpose first, improving our accuracy of a diagnosis, changing our treatment plans, helping patients get better, and transcending the career of PTs and owners. And that's what we need to do. And one thing too, conceptually, when I talk to owners or PTs, there's one thing to do an EMG or have an MRI. How many of us have had MRIs from a doctor where, we read it and we don't really do nothing with it in our treatment plan? The other thing that was part and parcel to me was, well, when we have these results, what are we doing with them? How am I aligning my team and my clinical team to then pivot care? Because if I'm just doing an EMG and it's showing something, but we're not actually changing treatment, what's the good of it? Maybe information to the doctor, but one thing that we teach to the members that are part of our group is we teach all the clinical team, not even the PTs that are doing an EMG. We teach the entire clinical team how to take those results. Based on the results, whether it's demyelinating, axonal loss, what specific neuromobilizations to perform, what spinal mobilizations to perform. Because if someone has axonal loss, you do not want to do certain neuromobilizations. But imagine for you as a PT or for you as an owner, having a team being able to absolutely pivot care based on a test that a PT does. It's absolutely game changing. And you create a culture in your organization that is cutting edge. So, I am excited. Hopefully you feel that, because I do believe that We need to do something as professionals. The doctorate degree didn't really take us to that status. But I can tell you this, today, after I had Diagnostics, sold my company 5 years ago. I exited at a very nice multiple. And Dimi said to me, look, why don't you come help PTs? And I said, sure, because I believe in it. I believe in us. And I know this is the right thing for all of us to do. It's different. You might be questioning, well, I don't know this, I don't know that. But the more knowledge you get from our program, the more certainty you have, and then you become a game-changing clinician. I can tell you right now, today, in my region, I have PTs providing EMG services, PT, I should say. He is the go-to guy for hand surgeons, spine surgeons, providing phenomenal reports for these doctors who are making decisions in patient care, and they're not going to the neurologist. They're going to my PT. You all can do that, and he's collaborating with physicians at an entirely new level. That's the autonomy. That's the decision-making. That's the critical thinking that we as PTs deserve to have. And from the financial standpoint, you will absolutely change your career for yourself if you're a staff PT. And if you're an owner, you're going to write your ticket to your financial exit. And money is okay. Money is just a form of energy that fuels our purpose as PTs. So embrace it and reach out to me. And I'm very excited that you guys are taking this journey. It will change your profession and your future. Mohammed, Mohammed is a member with us. And it's a good question that you ask in terms of professionals other medical providers that might think it's a conflict of interest as we're providing physical therapy treatment. And while ourselves as providing diagnostics and billing, is there a conflict of interest? Here's what I can tell you with bulletproof certainty. When we first did diagnostics, we put the codes in our plan of care. We provided the service. We realized early on, let's communicate with our doctors. Let's let our doctors know, number one, thank you for referring me Mrs. Jones. She's got some numbness in her foot. I really would like, with your approval, to do an EMG study, dial in what's causing that. I can fine-tune my treatments to make sure I'm getting your patient better. We used it as an opportunity to communicate with our doctors. And I can tell you this, 95% of our doctors, this was the response. Really? You do diagnostic EMGs? I didn't know that. We can't get our patients into a neurologist for 2 months. Can you share a report? Can you tell me what you do? Sure. I'll come in. I'll show you a copy of our EMG report. We'll provide you these within 24 or 48 hours. It was an opportunity to communicate with our providers. And when we demonstrated the value not only of a high quality report, but what we can do clinically to take care of patients, here's exactly what happened. We got direct referrals from ortho, hand, spine surgeons, foot and ankle. In 1 week, my PT did 17 EMGs, all referred by surgeons because they knew what we had. And because we're able to treat patients better, they're referring more people to us from a physical therapy standpoint. Okay, maybe we had a neurologist here or there and said, you know what, I'll send you PT, but please don't do EMGs on my patients. I do that. No problem. So those are the ones we don't do it with. But I can certainly tell each and every one of you this. Never let a doctor get in the way of your vision and what you can do, because at the end of the day, you will provide significant value to these physicians because more and more, they don't want to do EMGs. They don't want to sit in the room with a patient for an hour, and you're going to become a monstrous resource. I can promise you that.
Awesome. Thank you, Dan, and thank you for bringing some inspiration here. And I would like to share with all of you, as Dan said before, you can email to him at dan@ihads.com. This is the general number of Hands-On Diagnostics. And looking forward to share with you more information in the weeks to come. And look also for my new podcast, Your Practice, Your Money, where clinical success meets financial freedom. Very, very excited for this. And tonight, I'm going to make sure that always keep these short. I will never exceed 45 minutes. Thank you, Dan. As I said, I'm going to just leave you guys with a quick video tonight and see you all next week.
Because you're a physical therapist, you're not afraid to face pain. Where many see obstacles, you see opportunities. Because you're a physical therapist, you're always looking for solutions to your patient's pain, dysfunction, or disability. Looking at the surface of a problem will never be good enough for you. You're poised to tackle your patient's problems using every molecule of your body and every modern tool available to heal them. Because you're a physical therapist, you're a scientist and a pioneer. You are willing to step beyond the crowd and lead the way. You dare to dream the future of the profession, a future where advanced diagnostic technologies of ultrasound imaging and electromyography are at your fingertips. Hands-on diagnostics helps you see your patient's pain. Together, we can create your future of physical therapy now. It's time for diagnostics in physical therapy. Seeing is believing. Join the movement now.